is Arina Langkamar and our friend for the melodious song. Now, aware and beware. Now I give time to our resource person to speak on the theme aware and beware.
Respected our host, respected principal, professors, the organizers, students and everyone gathered here, a very good morning to all of you. First of all, I thank God and I also thank the organizers for giving me this opportunity to be a part of this program. This is my second time standing here. The first one was 3 or 4 years back, and this is the second time here, and I hope that we will all learn something from the presentation. Now, HIV/AIDS. This subject or topic is not a new one. I'm sure that we all have an idea and that we all have the basic knowledge about this HIV and AIDS. So I will not go much into detail. I will. My presentation will be very brief and the basic. And then after my presentation, if any doubts, then we can discuss. Now, before I go into the topic, I would like to share the scenario of the HIV/AIDS status in Mokokchung. Now, when we say ARTC Center, it means Antiretroviral Therapy Center, where treatment and care for HIV and AIDS is provided. So in Nagaland, we have 7 ART centers, that is Mokokchung, Dimapur, Kohima, Tuensang, Zinuputur, Kifrey, and Nukla. So these are the main centers where we provide the HIV treatment. Now, apart from these mother centers, we also have other sub-centers, or which we call as the link ART centers in different places for the convenience of the patients or the clients, to save time and money to reach the ART center. So accordingly, the treatment and the care is provided from the center nearest to the client's residence. Okay, so coming to the scenario in Mokokchung. Our Mokokchung ART center was first established in 2007. And since then, till date, we have the total registration of HIV patients. The registered is about 2,000. But then, this is just the tip of the iceberg. This is only the positive registered among those tested, because we have, many who are never tested, and this positive tested cases are only among those who visits the hospital. So we have very few numbers who come voluntarily for testing, and most of the positive cases are detected from the other departments in the hospital. So HIV testing is not mandatory, which is why we are leaving out many positive cases in the society. MNG, or Obstetric and Gynae department, where all the patients have to undergo mandatory HIV testing before they see the respective doctor. So, Gynae department is the only department where all the patients have to undergo mandatory HIV testing. Otherwise, from the other departments like medicine or surgery or ortho or other departments, not everyone undergoes the mandatory testing. Only those who the doctor is suspicious of, or if the doctor feels that he or she needs the HIV testing, then only they are referred for testing, and if they're tested positive, then they are referred to the ART center where they get registered. So the cumulative number of cases, about 2,000, that is not the actual number in our town. It is just the tip of the iceberg. The average number of detection of HIV positive in, here is about 8 to 10 in a month. And the average number, which I feel is very alarming, especially for a small town and place like ours. So that is how the gravity of the disease is in our town. So coming back to the topic, that is the HIV and AIDS. Most of the time we use the term HIV and AIDS synonymously, HIV/AIDS. But then the difference is that when we say a person is HIV positive, we all know that HIV stands for Human Immunodeficiency Virus, which is the virus that is causing the disease AIDS. So, and AIDS is acquired immunodeficiency syndrome. When we say syndrome, it's a group of diseases. Towards the end stage of HIV positive status, when it is the fourth stage or the last stage of the HIV infection, where the person is manifested with many diseases, not just one disease, but many diseases, including brain infection or like all the system infections, skin infections and all that. All this combined together, the end stage is called as the AIDS. But when we say a person is HIV positive, it necessarily doesn't mean that the person is suffering from AIDS. A person may carry the virus in their system, in their blood, for a long time before the person progresses into the AIDS stage. So depending upon the physiology, or depending upon the body immune system, it takes a span of about 5 to 7 years for a person from HIV positive status to progress into the AIDS stage. So if there is intervention in the form of medicines, okay, if a person is on ART, if a person is under medication, then a person may never progress from the HIV status to the AIDS stage. But without intervention, without medications, then it is definite that, as I said, in a span of about 5 to 7 years, that the person is definitely going to progress into the AIDS stage. So this is the difference. A person may be positive, HIV positive. When we say HIV positive, he may not be sick, she may not be sick, because he still has some few years to live as healthy. So we cannot say by just the look of a person that he or she is suffering from HIV or he or she has AIDS. It's only towards the end stage, at the AIDS stage, that we can say by the look a little bit that, considering his health and then considering the diseases that he is suffering from, we can make an idea that maybe this person is suffering from AIDS. But when a person is positive during the initial few years, it is very difficult unless you do a blood test. It is difficult, it is impossible to say, make out or say that this person has HIV. So it is very important to know our status, to do an HIV testing, and if tested positive, then to go for treatment as soon as possible, so that we remain in that HIV positive state and never, make it to the AIDS stage. Okay, so what are the different routes of transmission? How a person gets the infection? Number one is through sexual route. When we say through sexual route, it is unprotected sexual intercourse. That is, when we say unprotected, it means without the use of a condom. So what the condom does is that it prevents the contact of the fluids. So it is said that condom gives a 99.9% of protection against HIV. So when there is unprotected sex, then it is definite high chances that there is transmission of or getting the infection from the infected person. So number one is through unprotected sexual intercourse. That is one. Second is through blood and blood products, which includes IDUs, intravenous drug users. Previously, intravenous drug users, the transmission through this route was number one. But these days, with the less people using the IDUs, or with the use of disposable syringes, single-use disposable syringes, this route of transmission through this route has become less. But this is also a route of transmission, and it may not be just the IDUs, but then again, it may be from most of the time you get, this kind of accident happens in the hospital. After injecting or after giving medication injection to an infected person, sometimes the health workers, the staffs, we accidentally get pricked with the SAM needle, which was used to administer the medicine to the HIV positive patient. So, these are some of the accidental injury. Or if you have an open wound, fresh open wound, and then if that wound comes in contact with the blood of an infected person, then the blood gets direct entry into your open wound, and then you get the infection. or few incidences, not very frequent and may not be common these days, but especially in cases of boys sharing razors, especially in hostels. If a person is infected, if he has a cut, if there is remnants of blood in the razor blade, and if another person uses it, that may be also a cause of HIV infection. There was also an incident of a baby getting infection from the grandmother because the grandmother used to chew the food for the baby and feed, and she has the problem of bleeding gums, and she was also infected. So in that way, the baby also got infection from the grandmother. There was also an incident of a heart health worker in a remote area where there was an accident, and then she was the only one to take care of all the injured persons, and she had an open wound in her fingers, and then in the process of taking care of the injured people, her wound came in direct contact with the blood of the injured somebody in the among the injured were HIV positive, and then she also got an infection. There's a few of the incidences. I'm setting an example. Another maybe common among the boys. Two persons, they had a fight, and then one punched the other, and then both of them got injured. Their blood got mixed up, and then one of them was infected with HIV. So in that way, the other friend also got the infection. So there's a few not very frequent but incidences which can lead to HIV infection with the blood and the blood products. Now, number 3 rule of transmission is through blood transfusion. That is, when you're getting a blood transfusion, the blood directly goes into your veins. So, if the blood is infected with HIV, then the virus along with the blood is getting direct entry into your veins. So that is also the 3rd rule of infection, but we don't need to worry much on that because you just don't get a blood transfusion randomly. You get the blood transfusion in the hospital, and before you get a transfusion, the donor's blood is first screened, whether not only just for HIV but also for other diseases like hepatitis or typhoid, malaria. These are the first, the blood has to undergo screening test, and when the blood is clear, then only it is given to the recipient. So that's also not something to worry much on. 4th route of transmission would be from parent to child, from mother to child. So when a lady is pregnant, so they share the same circulation, the baby and the mother. So there are 40 to 60% chances of the baby getting the infection from the mother. But then again, if without intervention, but if the mother is detected HIV positive early in the pregnancy, and then she's put on treatment, she's put on ART, then the chances of the baby getting the infection from the mother becomes less. And we also advise the mother to deliver in the hospital, where medicine can be provided to the newborn right after birth for prevention of the transmission of disease. So it is very important that if a woman is pregnant, that she should do an ANC, antenatal checkup in the hospital as early as possible. And as I mentioned, in gynae department, all the clients, all the patients attending the gynae department undergoes mandatory HIV testing. So if tested positive, then if the treatment is started early on, then there is the chances of transmission becomes very, very less. We have a family, a couple who were HIV positive and they were not on treatment, and the first 2 babies which were born before the parents were initiated on the ART, the 2 babies were HIV positive. But after, when they started the HIV medicines, especially the mother, and the 3rd baby was born, then the 3rd baby came out to be HIV negative. So that is how effective ART medicine is in prevention. So this basically are the 4 main routes of transmission. That is, as I mentioned, first is through unprotected sexual intercourse. So I leave it to your imagination to how to prevent yourself from, since we are all adults here, we're all teenagers and young adults, so you know best how to protect yourself. Number 2 is, as I mentioned, through blood and blood products. And then number 3 is through blood transfusion, and number 4 is from mother to child. So basically these are the 4 routes of transmission which you need to keep in mind and come up with the idea how to prevent yourself from getting the infection. So after that, so what happens when through any of these 4 routes when a person is infected with HIV? So what happens in your body, or what happens to your system? Initially, when the virus enters into your system, it does not go directly into your blood system. It takes about 2 or 3 days for the virus to reach your bloodstream. So this 2 or 3 days is very crucial for medication for post-exposure prophylaxis. First, it goes into the lymphatic system. From there, in about 2 or 3 days, it goes into your bloodstream. When it reaches into your bloodstream, then it reaches your whole system of the body. But as I was saying, the initial 2 or 3 days is very crucial. That is, if accidentally you come in contact with or you are exposed to HIV, then within this 2 or 3 days, if you start medication, we have a medication called as the post-exposure prophylaxis, then the chances of you getting the infection, it becomes less or becomes 0, because the virus has not yet reached into your blood system. So, but again, it is very difficult if you have to say whether you have been exposed to an HIV positive person or not. For example, if you have an unprotected sexual intercourse with a person, you never know that whether the other person is HIV positive or not. Because as I said, when a person is in the stage of HIV positive status, you can never tell that maybe he has or she has HIV. So it is very difficult to predict there. So it is very important for protection. PEP comes very important in cases of injury to the staffs in the hospital, because we know the patient that we are treating is HIV positive. So if you in case accidentally come in contact with the blood, or accidentally prick yourself by the needle which was used to the patient, then definitely you come to know that this, because we already know that the patient, so most of the staffs, we start the post-exposure prophylaxis medicine immediately or within 24 hours. In that way, we have many, even doctors, nurses and other forthright workers exposed or pricked by needles or like exposed to the blood, and then they are given the PEP medicine, post-exposure prophylaxis medicine for 1 month, and then till date we do not have any positive result among those who were started on the PEP medicine. And then even like doctors and nurses, as I said, so we have more than about 20 health staffs like who has been pricked and started on medicine, but their test came out to be negative. So this 2 or 3 days time period is very important for prevention of the HIV if the medicine is taken. So just like it's in the rabies, if you are bitten by a rabid dog, then if you take the post-exposure prophylaxis vaccine within 72 hours, then even if you are bitten by the rabid dog, you don't get the disease rabies. So in the same way, this for the HIV also is the same. Within 3 days, if you as early as possible, if you take the PEP medication, then even if you are accidentally exposed to the virus, you are safe. So that is one thing. So after entry into the blood system, what the virus does is that the virus, it will multiply on one side. They multiply in millions in a day. So they'll keep on multiplying from 1 to 2 to 4 to 8, and they'll keep on multiplying. And as they multiply, as they increase in number, what it does to our body is that it kills our CD4 cells, which are called as the soldiers in our body. They are the immune system in our body. So as the virus increases in number, they will kill the CD4 cells or the soldiers in our body, and who are mainly responsible for our good health, for protection against any diseases around us which we are exposed to, which we come across. No, we are all healthy here. Why? It's because our immune system is strong. There are so many viruses and germs and bacteria around us, Especially TB germ is everywhere, but why we are not suffering from TB is because our immune system is strong. Every day they always are trying to find an opportunity to enter into our body to infect us, but our immune system, it fights back, and then this CD4 cells, they fight back, and so they do not get entry. Even if they enter our system, they are, our immune system fights them back. So that is how our immune system works to keep us healthy and protect from infections. But when you are infected with HIV is, as I mentioned, the virus, they multiply on one side, and on the other side they will kill the CD4 cells. So they don't kill the CD4 cells in one go, like slowly and slowly. As I said, HIV positive status, it stays for some years. So like the virus increases and it kills, it suppresses the CD4 cells slowly and slowly over a span of few years, and then ultimately when it reaches the normal CD4 cells, the number of soldiers in our body are about 800 to 1000, the normal cells. Now this virus will slowly kill them, and then the number comes down, and then the CD4 cells, the soldiers become weaker, and then less in number. So any diseases or any infection which tries to enter our body, or which we are exposed to, they are unable, they are weak, and they are not, they are less in number to fight them back. As a result of which, one by one, the infection, taking this opportunity of our weak immune system, they get entry into our body. And depending upon what type of virus or bacteria enters into your body, that disease will manifest in you. So if you are exposed to a TB germ, then our immune system can't fight them back, so you'll get TB infection. Maybe infection of the brain, it may be infection of the skin, or any system, any infection which enters, and then that disease will be manifested in you, and then you will show signs and symptoms of that particular disease. So not just one disease enters. Our immune system is weak, they are less, so any infection can come into your body, and then you will show signs and symptoms, you will show suffer from that particular disease. And so this group of infection, as I said, is called as the syndrome. It's called the AIDS stage. Then you come to know that you have reached into the AIDS stage. So before reaching into the AIDS stage, it is very important to start the medication. So that is how the pathogenesis, how the virus progresses or leads to in our body when you are infected with the HIV. So what next? So if you are positive, okay. If you are infected, okay, but that is not the end. Previously, when there was no medicine, then when you are infected, in about a few years, it was definite that we die. But with the invention and with the research of medicines and invention of medicines, now a person can live as long as you intended to live by God. So with ART, that means with medicine, you can live as long as you are meant to live. But without treatment, then as I mentioned, within a few years, you are definitely going to get into the AIDS stage, and then even if you start medicine, works for many people, but since it is too late for them, so becomes too late for some people. So ART means it is called the antiretroviral therapy, that is the drugs. So there are different combinations of drugs. So depending upon your report, when a person is detected positive, so the detection or the testing is done in IMTH centers, that is the blood testing center. And when a person is tested positive, then the outreach worker there assists the patient to the ART center for registration. And the ART center is equipped with counselors and nurses and other supporting staffs. And so they are given counsel, they are counseled, and then they are again sent for some additional blood testing. And then with the result, depending upon the result of the investigations, then there are different combinations of drugs which we give accordingly. So how does this HIV, ART works? We all know that there is no cure for HIV, but there is medicine to sustain our life. This ART is the medicine to sustain our life. It's just like diabetes, or it's just like hypertension, high blood pressure. There's no cure for it, but as long as you take the medicine, your sugar is kept in control, or your blood pressure is kept in control. Likewise, ART also works in the same way. Even if it doesn't cure, but it controls the virus so that you can sustain your life. That is how it works. So there are different types of drugs. Some drugs they work for 12 hours, and some drugs they work for 24 hours. So the peculiar character of this ART medicine is that it has to be, you have to follow certain rule while taking these medicines. That is, for other diseases, when the doctor says that you take this medicine once in a day or twice in a day, you can take any time of the day, or you can take any time, after meal. But regarding the ART drug, it has to be taken at specific times. That is, as I mentioned, some drugs, most of the drugs now, the newer drugs, it works for 24 hours. So if you take a medicine tonight at 8 o'clock, it has to be taken exactly at 8 o'clock tomorrow, because the medicine will control the virus just for 24 hours. So the medicine puts the virus to sleep. It paralyzes this virus so that it does not replicate, it does not what we call multiply. So the time, because tomorrow if you take at 9 o'clock, it gives the virus a window period of 1 hour for them to wake up and multiply more. And the problem is not just multiplying, but the problem is mutation. The virus undergoes mutation. Because just like any other living beings, we have the instinct for survival. So even the HIV virus, they want to survive. So not taking the medicine at the right time will give time to the virus to multiply as well as to mutate. Mutation means they will change their forms, their shape, and then they will prepare themselves in such a way that the medicine will no longer have effect on them. So that is the most dangerous part of not taking the medicine at the right time, because till now we have first line of drugs, second line of drugs, and third line of drugs. So if the first line doesn't work for you, then you are put on the second line. If the second line doesn't work on you, then you put on the third line, and after that we don't have any option for further treatment. So it is very important that a person remains in the first line of treatment or the second line of treatment for as long as possible, and that can be maintained only when the rule of taking the medicine can be maintained. So if I say in a 1 hour delay in taking the medicine gives the virus the chance to multiply so much and to develop resistance. Then just imagine missing your drugs for weeks or months. It gives them ample opportunity to multiply and also to undergo mutation. And then, as I said, at the end of the day, there will be no medicine option for you, to combat with the disease. So this is very important. So how does this ART medicine works? Again, let me come back to it. It binds or it paralyzes, it puts the virus to sleep. So they do not multiply and they do not get the chance to attack or to kill the CD4 cells, which were already, they were killing, and then they were becoming less in number and weaker. So when the virus cannot kill them or the virus cannot attack them, our CD4 cells are soldiers. They begin to increase in number, they become stronger, and if you are on medicine, following the strict rule, then within six months of starting of the ART, you're as healthy as any other non-infected person, because your CD4 cells have gone up, they have become stronger, they have come back to their normal number. In that way, again, your immune system is strong enough to, to prevent any infection entering into your body. That is how the ART works. ART, it's just the opposite of what the virus works. ART will bind them, they will paralyze them, and our CD4 cells will increase, and you are as normal as before. So this is how the ART works. So we have clients who are on first line of ART for more than 30 years. They are still on the first line, and then the medicine is working maximum, and then they are healthy, and we can never tell by the look that they are HIV positive. So that is how the medicine works. We have babies who were started on ART, and then now they are in college. So that is how effective and powerful the medicine is. So it's very important that we know our HIV status. If tested positive, come forward and go for treatment. Then, as I mentioned, you will live as long as you intended to live without progressing into the AIDS stage. Lastly, the regret or the sad reality of our society is that we say that we are aware and we have knowledge, and we are educated, but when it comes to detection of the HIV positive status, in spite of the treatment, in spite of the, not exactly a cure, but in spite of treatment and care, which can sustain our life, many people, they lose their life. Why? Because number one is because of stigma and discrimination. Instead of coming forward for treatment, they go more, deeper into the dark, and then because of fear of, rejection by family, friends, and things like that. So number one, why people, in spite of the treatment, why people are still dying or still suffering, that maybe that is, I've seen that is one of the causes. And then, especially in cases of boys, when you are detected positive, then again, they go into depression, and instead of coming forward for the medicine, they go into drinking and other substances, and as a result of which that habit kills them way earlier than the virus would have. Then other again, sad realities are about divorces. When they are tested positive, again there are many divorces, and then there is also the blame game of you brought the infection into the family, many broken families, and then really sad, especially for the children with no fault of them. The parents are infected, they die, and then none of the close ones or the relatives, they want to adopt or take care of the child, and so they are neglected, and then in that way they lose their life. So we have seen cases like that also. So as I said, in spite of all this knowledge that we have, still we are losing lives, and still there are many who are positive but are never started on treatment. So today's this thing, what we call this sensitization program, I request that not just keeping the information to yourself, but spread the message and pass on the message to your loved ones, family, friends, and people, so that we can at least lessen the number of what we call infection, and let's work towards the prevention of the disease. I would request every one of us to be really beware of this disease, because this is really happening, and then let's be responsible citizens in the society. So with that, I've come to the end of the basic presentation of the disease. If any queries, then you can put forward your doubts, and we'll try to discuss about it. Last time I came, I think the crowd was more interactive. I request, or maybe you have understood, and if any doubts, then if not now, you can always contact me or contact the staffs, and we will try to clear your doubts. And regarding the blood donation, Dr. Abu, who was in charge of the blood bank, he has to go out of station at the last moment. So I request Makshi to say a little bit on the blood donation and the importance, and related to the blood donation. Thank you.
Good morning, ladies and gentlemen. Respected Chairperson, Principal, faculties, and my dear friends. Just supplementing to what Dr. Amenla said, is that in a year we get around 115 to 120 positive cases, fresh cases. From April till September, we have 65 new cases of HIV. Whenever we go to college, we talk about ABC of HIV/AIDS. A stands for abstinence, that is, abstinence yourself from sex before marriage. B stands for be faithful to your partners. And then if you don't follow A and B, we follow number C, that is, use condom. That doesn't mean that we're encouraging you to have sex. Right. Now coming back to blood donation, why is voluntary blood donation necessary? Because many people in hospitals or in our daily life die of wanting for blood or loss of blood. Blood cannot be regenerated or synthesized artificially. Blood can be only produced by oneself. So in India, about 12 million units of blood is required annually, but we can produce only 9 million units of blood. So there are 25% deficit in the blood. Now there are three types of blood donors. First one is professional donors, second one is replacement donors, and third one is voluntary donors. Professional donors are the donors who for an easy buck they donate blood regularly. Regularly in a very short span of time. So they may be drug users usually. For an easy buck they donate blood. So the Supreme Court has put a ban on these professional donors. On January 1, 1996, they said that they'll put a person being a professional donors will be put to jail and with a fine of 3,000 rupees. Now, replacement donors or donors can be anyone from the family members in the community. Okay, and then third comes the voluntary donors. Voluntary donors are donors who donate without expecting anything in return. Now, who can donate blood? A person who is 18 to 65 years of age. Anyone below 18 years here? Show of hands. So I think everyone can donate blood today. The weight should be 45 kgs and above, and blood pressure should be 120 to 80, and then the hemoglobin should be 12.5. Now it takes about 15 to 20 minutes to draw a blood from a person. Now we usually take about 350 ml of blood during one unit of blood. 350 units of blood is usually drawn from the blood during a donation. We usually store it in the fridge in the 2 degree to 6 degree for 35 days. After 35 days, we usually discard the blood. Now, post donation, what we usually do is we advise you to drink a lot of blood, a lot of water, a lot of fruit juice, and then you avoid taking heavy exercise or lifting heavy objects. Now the benefits of blood donation. We usually test for hemoglobin, blood pressure, body weight, hepatitis, syphilis, and HIV is usually before or after donation. So this is a benefit. Now, who cannot donate blood? A person who has heart disease, lung disease, kidney disease, cancer, epilepsy, diabetic, TB, allergic, jaundice, sexual transmitted disease, and then in the past 72 hours, if you have antibiotic, aspirin, alcohol, or steroids, vaccination, those are the people who cannot donate blood. And for a woman, if she has a major or minor surgery or blood transfusion in the past 6 months, or for a woman, if you are pregnant, if you have an operation, or if you have child less than a year, and if you have breastfeeding, or if you are breastfeeding, you cannot donate blood. Now, the reason we go to college and school talking about blood donation is that you are a fresh mind, this is donate, you'll be a regular donor from now on. Now we usually celebrate 2 events in a year. The first one is June 14th, this is Blood Donors Day, and then 1st October, that is National Blood Donation Day. You may not be a donor, but you can take care of patient by donating blood. You can save a person by donating the blood. Thank you. Thank you.
so much, ma'am, for speaking to us about the importance, awareness, and the mitigation regarding HIV and AIDS, as well as to serve for sharing us the necessities and significance of blood donation. So through this, we have come to an end of our today's program, and I would like to thank each one of you for virtually participating and attending the program. This program is again followed by blood donation camps, so I request all the students who attended this program to kindly help out and save the life of the needy one by donating your blood. If there is anyone who is willing to donate your blood, can kindly go to the conference room for the blood donation. And information, all the students are requested to stay back for the attendance.